Namaste Vidya, Hamesha Khush Raho Vidya. A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine and Faculty of Homeopathic Science at JAYOTI VIDYAPEETH Women's University, Jaipur. In today's lecture, we are going to continue with the neurological examination. And today we are going to be testing for aphasia. We are going to discuss about what are the things that are needed to be asked if a patient of aphasia is coming to you. Aphasia is basically a neurological derangement by which the patient is not able to speak properly. There is some disorder in the brain due to which there is disorder in the language. He is not able to speak properly, read properly, and to comprehend properly. Also not able to write properly. So aphasia is basically related to the language or the speech of the patient. So if there is any kind of lesion in the brain, then and the patient is not able to speak properly, is not able to read properly and to spell properly, then that is known as the aphasia. So we are going to discuss about the important things that are needed to be asked while doing the examination for aphasia in the patient with brain disease. So there are basically 5 important things or the 5 different steps that are needed to be done or that are needed to be checked for in case of aphasia. First of all, we have to check for the word comprehension. Then we have to check for the repetition. Third is we have to check for the naming, how the patient is naming. Fourth is the reading comprehension, and fifth is writing. Any derangement in all these 5 things consist of aphasia: word comprehension, repetition, naming, reading comprehension, writing. I will again repeat these things: word comprehension, repetition, naming, reading comprehension, and writing. So what is word comprehension? Comprehend is to understand. So word asks the patient to follow a one-stage command, such as to point your nose. Just try to point your nose. Point your nose. Try 2-stage command. Point your mouth. Then your knee. So you are trying to comprehend. You are trying to tell a patient and try to understand, make him understand. So he is doing 1-stage command, 2-stage command, and 3-stage command. Whenever you are speaking something and whether the patient is able to comprehend, is able to understand properly or not, whether he is able to understand one thing or he is able to understand 2 things or he is able to understand 3 things. All these have to be taken into consideration. So word comprehension means that whether a patient is taking your one command, that is, you are asking the patient, point your finger to the nose, point your nose, point your mouth, point your knee. So what command is he taking or he understanding? That is word comprehension. Comprehension is to understand. All right. So this is the first point, that is over. So if you are trying to assess about aphasia, then you have to comprehend, do the comprehension for word comprehension. The next point is the repetition. Then you have to check for the repetition. You have to ask the patient to repeat the phrase of one syllable. That is, first of all, you are asking the patient to repeat something. You are saying something and you are asking the patient to repeat after you. That is, suppose today is Tuesday. So you are asking the patient to repeat today is Tuesday, today is Tuesday, today is Tuesday, today is Tuesday. And if the patient is not able to repeat, then that means the conduction aphasia. Repetition failure occurs in conduction aphasia when the patient is not able to repeat. First one was the word comprehension. How he is understanding. What is he understanding? Is he understanding your word properly? That is word comprehension. The second, that is repetition. Whether the patient is able to repeat the things properly or not. You are asking him to repeat something. That my name is so and so. My name is so and so. My name is so and so. If you are repeating, then it's okay. If you are not able to repeat, that means you are having conduction aphasia. So we have discussed about word comprehension. We have discussed about the repetition. Check for aphasia. Now the third point. The third point is naming. So how do you assess aphasia by naming a patient? Ask the patient to name a shown object. Suppose you are showing him this pen. Now ask him to whether he can say the name of this particular thing. So this is a marker. So if the patient is able to tell you about this marker, that means he is able to name this thing. The test can be made difficult by asking the patient to name the components of his watch. Suppose he is wearing a watch, then you have to ask for the components. What are the components of his watch? Which is the hour? We are having three components. We are having hour pointer, we are having a minute pointer, and we are having a second pointer. And also we are having numbers 1 to 12 in the watch. So you can ask to name various things. You can ask him to name about the mobile. You can ask him to identify this thing, marker. You can ask him, the patient, to identify this handkerchief, or you can also ask him to identify the bottle. So there are different things about which you can ask the patient to name these things to check whether he is able to answer the question or not. So for checking the aphasia, we have checked about the word comprehension, whether he is able to follow your command. We have checked about the repetition, whether the patient is able to repeat what we have said. Then whether he is able to name various things. Now, suppose this is a sheet. All right, this is the sheet. Then whether he is able to tell you about this. This is the register. This is the register, whether he is able to tell you about this register, attendance register or not. So that is naming. Next is the reading comprehension. Now, what you are doing in the reading comprehension is you are asking the patient to read a particular paragraph, whether the patient is able to read a particular paragraph properly or not. And not only properly, but loudly. This may reveal the association of dyslexia. So if he is having any problem in the language, then that could be traced out. So for checking for aphasia, you are asking the patient to read loudly a paragraph from the book. If he is able to read the paragraph properly, then it's okay. And if not, then there is some problem with the speech. Then the last point in assessing aphasia is writing. Then you ask the patient to write a sentence. You are going to speak something and then you are going to ask the patient to write something. This cannot be assessed if the patient has motor deficit or writing hand. So if a patient is having any kind of motor deficit in the hand, then that cannot be assessed. Errors of form, grammar, sentence indicate dysphagia. If that particular patient is doing any kind of errors in form, in grammar, and in sentence making, that it indicates dysphagia. A person who can write a correct sentence does not have aphasia. So if you are telling something to a patient and the patient is able to write properly, correctly, then the patient is not having aphasia. So we have discussed about 5 different things by which we can check for aphasia. Number 1 is word comprehension. You are telling something and is that patient is able to follow your words, do the things that you are asking for. Repetition, you are speaking something and you are asking the patient to repeat after you. Naming, you are naming certain substances, what is it, and the patient is able to recognize and name that particular substance. Reading comprehension, by asking the patient to read loudly a particular paragraph without any problem. And writing various sentences that you are telling the patient to write. So these are the 5 steps by which you can assess for aphasia, that is any kind of neurological disorder in a patient. So this was all for today. In the next lecture, we are going to check for the examination of the neck and cervical spine. So this was all about aphasia. This session was powered by digital version 2.0, JAYOTI VIDYAPEETH-FHS University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve. So this was all for today. Thank you very much. We will be meeting in the next lecture.